contraindications. There's certain people that can't do it because of like things like, having a blood clotting disorder, being on blood thinners, things like that. There's a few things that, would preclude you from being able to do this. But most healthy people can do blood flow restriction. There's really not a whole lot of downside. There are some cases of a few injuries that have occurred with probably improper use and non-high-tech cuffs. But the cuffs that we use are very high-tech, very easy to operate, and they're fairly user-friendly. They're very user-friendly. And so some of the protocols that we do for blood flow restriction therapy is we do a little bit higher reps and lower weights. So some of the studies are showing that at about 30 to 40% of your one repetition max, so the maximum amount of weight you can lift, with BFR, you can get the same amount of muscle hypertrophy at early phase rehab as if you're lifting 80% of your one repetition max, about 80% of your one repetition max. And so the good thing is for things like ACL like people that have anterior knee pain, people who have had a meniscus transplant or a cartilage surgery that can't take a lot of mechanical load or a lot of weight load, we could do exercises with much less weight and get similar result in maintaining muscle hypertrophy. And so that's been a huge piece of our post-operative rehab for both the upper extremity and lower extremity. Unfortunately, you can't do it for like core injuries and back injuries, things like that. Although I did have an interesting case of a guy who had a radiculopathy, an injury to the nerve that came from his lower back, and he had almost no calf strength. And we did BFR for 6 months, and he was able to produce body weight strength of that calf by the end of 6 months, which was very
awesome.
Cool because previous to that, he just couldn't physically load his calf enough because of the lack of nerve reception to the calf. So we've seen really good results with it, and it's just another tool in our bag that we use early on, especially in post-op cases, to help people get back to 100%.
Hey, Zach.
Yeah, I know. I love it.
Yeah. Are there any restrictions? You mentioned certain restrictions when it comes to maybe the type of medicine you're on and blood thinners, things like that. And I know Dr. Garcia and I talked about BFR before and kind of going back to this KATSU training. But is there an age restriction? Is this for all ages, or is there a ideal age group that this would benefit?
No, that's a great question. It really could benefit from people from all ages. So I've used it up to people age 75.
Wow.
Obviously and unfortunately, as we age, people tend to gain comorbidities, and they tend to have things like elevated blood pressure. They're on statin drugs. They're maybe they've had a stroke in their history or TIA, and they start to gather these contraindications to blood flow restriction. So I think, like as the population ages, you become a little bit less of a candidate for blood flow restriction therapy, but you're not necessarily precluded because of age. And then the younger ages, that's kind of an interesting topic right now going around. And I talked to a couple surgeons recently who say, hey, as long as someone is, 12, 13 years old, basically hitting puberty, I've got absolutely no problem with them doing blood flow restriction therapy. It's all about tolerance though, right? Because these cuffs at 80% occlusion of your lower extremity, we usually don't start at 80. We start to get them comfortable at 60, then we work up to 80%. At 80%, those cuffs are tight. And maybe, Dr. Garcia, I'm sure you felt this too. It's not the most comfortable thing in the world when it's pressurized around your thigh and squeezing. And so, some younger kids wouldn't have as good a tolerance to it. And some people in general don't have as good a tolerance to it. But I'm always surprised when I'm like, hey, I warn people, I say, hey, this is uncomfortable. Let me know if it bothers you too much. It's not 100% essential to your care, but it will definitely help you. And most people are able to just, hey, I got used to it and now I love it. And we have a lot of patients that actually end up buying the cuffs for themselves to continue to do their workouts because, they love the results so much.
And that's a big thing, Will. The people do that all the time. I hear that they come in, they say, I bought my own because I was so happy with the results.
Yep.
It's a big deal. And for me, it's one of the, if I've got go-to PTs, I really want to make sure blood flow restriction is an option for the patients, especially when those patients, they're 4 months out, Zach, and their quads don't look great and their ACL, and you're like, are you doing blood flow? And they said, no, I've never tried it before. And to me, that's a concern, right? I'm also concerned if they say they are doing it and they look weak, but I don't tend to see that as often. Again, anecdotal, one surgeon. But I think it's important, and it's a real thing. And I have a couple of videos of me doing it, and there's a burn. Will you feel like you feel very weak within a couple sessions when you start doing it?
And I actually do it a lot myself. Yeah, I do it a lot myself. I've had knee surgery on both my knees. I've had posterior patellar surface cartilage injuries, osteochondral defects, and so like injury to the cartilage behind my kneecap. And one of my training tools when I'm doing knee load to maintain quad size, especially on my right knee, is blood flow restriction. And yeah, even just cycling for 15 minutes with blood flow restriction cuffs on, is even on light resistance, it is a massive feel of workout. Like your legs are on fire by the end of it. And the great thing is you don't have to load the knee, so my knee never hurts after I do BFR, but my muscles are always sore. And that's a sign to me of something that I need to be doing for my own personal knee. And I know that a lot of my patients experience the same thing where they say, hey, yeah, my knee didn't bother me at all, but my glutes and my quads and my hamstrings are really sore, but like in a good muscle way that I haven't gotten to feel for a while.